Unfortunately, I don't think there's any movement on that at the federal level. We're not aware of any states that have made a push for it. Some states have opted to give food stamp benefits to SSI recipients, but that results in a reduction of the SSI benefit for those individuals. So there's not good news on that side. That there is a bill in the Senate and the House right now that would improve the overall benefit that's offered by the SSI program. So it would increase the asset limits, would increase the earned income disregard, and so would raise the total benefit amount, but would not take head on the issue of the eligibility for food stamp program as well, unfortunately.
I think either works, right? If you increase the bottom line in terms of the amount of money that someone can have available per month, then it's fine to me if you do that by increasing SSI, or if SSI stays the same, but you say we're going to also provide you food stamps. So the bill number, do you know who's carrying the bill in the House? And
yeah, so in the Senate, it's Senators Warren and Brown. It actually needs to be reintroduced this Congress, and they're getting ready to do so this month, we hope. And in the Congress, in the House, it's the lead sponsor is Representative Grijalva from Arizona.
Thank you.
Sure.
Thank you so much for your testimony today. Thank you for putting a face on what we have to do. And I thank you for your time.
Thank you.
Thank you, Chairwoman.
I would like to now invite another courageous senior Californian, and her name is Sandy Costa. Sandy is a retired RN, and she will be joined again with Rochelle Sherlock. Thank you, Rochelle. And I know you're noticing that these are ladies, these are females. Well, we could not, we invited others to, some older gentlemen to come and share their stories, but their schedules would not permit them being here today. But they can, because women are turning out to be most of the caregivers, this is very, very appropriate that they are here. So thank you so much.
Great.
Ms. Costa?
So could I, just before...
You want to introduce her?
I would like to introduce her. You know, what I've been hearing, actually, and I'm really so sorry that so many of our committee members had to leave. We've been talking a lot about people who are receiving SSI and SSP, and we're talking about an annual income of less than $11,000 a year. So very, very low, very difficult to live under those kinds of things. In Solano County, 1 out of 10 seniors live below the federal poverty level. And then if we take in the Elder Economic Security Index, we're at almost 25% of all senior households are below the Senior Poverty Index in Solano County, according to the Elder Economic Security Index with the Insight Center at UCLA. What I wanted to say, though, is that is just like the most extreme seniors in most extreme poverty. And there's this other group of seniors who actually make just a little bit above that. They're not entitled to programs. They're not eligible for other additional benefits. And therefore, they're really penalized for working hard, for doing the things that they did to save. And this is the case with Sandy Costa. And so I'm really glad that she's here because of, as you had mentioned, Chairwoman Brown, you know, she has a college education. She was a registered nurse for over 30 years and really lands in that gap. And I think that's just equally important for us to address. So with that, go ahead, Sandy.
Thank you, Rochelle, and thank you, Chairman Brown, for having me here today. I'm actually glad to be here, and I was eager to come. As Michelle kind of pointed out to you, Rochelle, my case is a little bit different because I do have a college degree and because I was a professional person. The main point I want to make, though, is even though you are college educated and you are a professional person, you can still end up in poverty. Okay? It's a very, very real thing, especially for the baby boomers that are coming up. It's going to affect more and more of them. So my basics, and I want to tell you my basic story so that you know why I ended up in poverty. I was a single mother, divorced early on, raised 2 boys by myself. So that took up all my income. I actually went to college after my divorce when they were very, very little. I mainly worked in neonatal intensive care units. I was a transport nurse in the state of Montana. I've actually been a director of nursing and part of administration at Sutter Solano in Vallejo. So I've had a very, very interesting career. But at the after my children were raised, I remarried the love of my life, but unfortunately he was disabled also. So again, I was the main breadwinner. So there wasn't a lot, of money to save at that time. He passed away in 2008. At the same time, actually, the year before, I started a series of 5 different operations to my hands. Unfortunately, my nursing career had contributed to that. When I was a transport nurse, I had to lift a lot of heavy equipment. I developed severe osteoarthritis in these joints with ganglion cysts. So ultimately, I have 2 implants here. But what that did to my nursing career was basically stop it. I couldn't work as a nurse anymore because of the lifting and all of that's involved with being a registered nurse. So, and then my husband died. He had been a fireman for 20 years. He was let go from the fire department because of emphysema, which again, he probably developed on the job with all the smoke, plus he was a smoker. When they let him go, he lost his pension. That completely astounded me. Back then, that's the way it was. If you were let go by the fire department for any reason, you lost your pension. So that when he passed away, I was left with nothing. Even his Social Security, I only got 2/3 of once he passed away. All right. So over the next couple of years, I spiraled down, down, down until I got to a point where I had a mental breakdown. And even today, that's hard for me to admit. Me, the one who was always in charge and took care of everything and everybody else. And I'm really still recovering from that. It was very, very hard, but I'd lost my husband. I lost my home. I'd lost my income. Even my main support in my family. I have a son who's a career officer in the Army, and he and wife and family were transferred to Europe. So they were far away, far away. I had nobody. But the things that really hit me hard with this breakdown was the fact that even though I was eligible for Medi-Cal, because of what I brought in, I had a $1,200 a month copay. You understand what that means? In other words, I had no medical care for 4 years. For 4 years. Until I turned 65 and could get on Medicare. And even that is a drain. For all seniors, you've got $104 going out. Plus, you have to have supplemental, which for me is another $75 through Kaiser. And after all is said and done, with all of my other expenses, I had no money for copays. I mean, just take a basic scenario here. Say I go to the doctor, $30. He orders or she orders x-rays, another $30. I have to go to the lab and have lab work, another $30. And then dependent on what those results are, I may need more things that are each going to cost me $30. So for the first couple of years with Medicare and Kaiser, I never went to the doctor. I couldn't afford it. Fortunately, I did find out, and you can pass this word along, Kaiser has a program called MFAP, Medical Assistance for Poverty for Poor People. I kind of heard about it through the grapevine, and I applied for it. And so now I am able to go to the doctor because they do take care of all the copays. So, but they don't advertise it. not at all, but it is out there. And it's a good thing because now I have developed osteoarthritis in my left knee and I do need a knee replacement. So otherwise I would have never been able, to get this much done. So I guess the point I am trying to make is that even for me, and I take in $1,800 a month, it's still a struggle. I have a car, which I have to maintain, but I still can't afford any regular housing. I'm in Senior Manor in Fairfield, which is not a good place to live. It is not. It's so substandard, even by federal guidelines, that we've now organized a tenant association to try and improve living conditions there. I do try to help out to pay back, so to speak, with other seniors in this community because 90% of them are in a far, far worse shape than I am. I provide transportation to a lot of them, whether or not they can pay me a few bucks, it doesn't matter. I've actually supplied food for my 83-year-old neighbor who didn't have anything to eat. So it has been a real eye-opener. For a long time, I was very bitter about my situation. But now that I stepped back and I looked at it, it's all for a reason. I've been put into poverty so that I can help. Alrighty, which I would have never done. I would have never done if I had had the money to live on my own. So I do see some value in all of this in that, I can help other people, and that is what does keep me going. It's hard. It's extremely hard because even though I have this $1,800 a month, still by the time the month is over, if there's extra expenses, the money's not there. Just like it's been recommended that I have water aerobics for my knee, I can't do it because I can't afford it. And it's the little things like that that just drive you batty. They really, really do. Things that you have been used to having in the past, but now you can't.
Well, Ms. Costa,
yeah,
I really appreciate you being here today. I appreciate your testimony. It puts a face on what we're talking about and what this is about today. And I would like to welcome Mr. Ian Calderon, who is the chair of he's chair of Arts, Entertainment, Tourism, Sports, and Internet Media. Whoa, a mouthful. Did you have something you wanted to add?
Yeah, thanks, Chairman Brown. And I do want to say thank you for your leadership on these issues. I mean, you continue to bring these issues to light. I also want to thank Assemblymember Kansen Chu, who's one of our new members, but I know is a fighter for all of you and is someone that you can look to, along with Ms. Brown, to be your champions on these issues. I've been very blessed in my short time in the legislature. I've been here for 2 years. Ran my campaign when I was 25, elected at 27, now I'm 29. And one of the first things that occurred to me was as there seemed to be this opinion that because I was young that maybe I didn't care about what happens to our seniors. And that could not be further from the truth. And that the next generation absolutely cares about what happens to our seniors, what happens to our parents, what happens to our grandparents. And over the first 2 years, I was able to champion an issue, which I can continue to work on today along with Ms. Brown, of our community care facilities, residential care facilities, and unannounced annual inspections. We went from annual inspections to where we are the worst in the nation at once every 5 years. And that's where we are right now. And we're fighting to get back there. Finally, in this budget, while we are still excluding children and those community care facilities for children, at least in the budget right now, we are looking at moving towards annual inspections. At least the governor has recognized the importance of that. And working with the agency, we're looking to, by 2018, be at annual unannounced inspections of our community care facilities, residential care facilities specifically. But I was able to stumble across another issue. And I'm so happy that I got to hear your testimony because it speaks specifically to what you're talking about. And first, I want to say you should never feel ashamed about what you've gone through. You're a fighter, an absolute fighter. And never for 1 second think that that's something you should be ashamed about. I understanding what you have been talking about, have been looking at the affordability of long-term care here in the state of California. It is unsustainable. It is too expensive, and there is no remedy on the books.
Yeah.
So I, this year, am proud to author legislation, which is AB 332, which will create a long-term care insurance task force to work specifically with the insurance commissioner to find a solution to affordable long-term care. This is something that myself, Ms. Brown, Mr. Chu are going to work very diligently on. Long-term care, affordable long-term care, shouldn't be a privilege in this state. It should be a right.
Right.
That's what we need to work towards. And I want you to understand that this legislature, these members, care about that. And we're going to do everything we can to try and find a solution so that life isn't so hard on you. And that when you're dealt a bad card, or not even a dealt a bad card, when you're just dealt life, the life card, you can afford to keep going, to move on, and to afford long-term care. That's a commitment that we as a state and as a legislative body need to commit to. And I want you to know that there are people here that care about you, and that we're going to fight to continue to make sure you have, or fight to actually make sure you have in general, affordable long-term care. So thank you for your testimony, and thank you all for being here today.
Thank you, Ian.
Thank you,
That's
Mr.
great.
Thank you,
I'm glad
Mr.
you're in
Calderon.
report. Thank you.
You know, as Mr. Calderon was speaking, I'm reminded that we have to also end gender pricing, because with long-term care comes a gender pricing that is really against females. So we really need to look at that.
And Madam Chair, I do believe that Ms. Gonzalez has a bill specifically related to gender pricing.
Oh, good, good. That's great. Well, I really appreciate it. Thank you again. Ms. Sherlock, did you have anything to add to that?
You know, the only thing I would say, and I also applaud looking at long-term care, but until seniors can eat nutritious foods and don't have to make a choice between medications and food, until they can be treated with dignity and respect within their places of living, and that property managers are held accountable and they don't have to live in fear and be terrorized, and many of them are being terrorized, until we can begin to address some of these core issues. We have seniors who are hiding in their apartment complexes, who are depressed, and who are committing suicide or contemplating committing suicide. It's a big issue. And so on some level, I totally agree about the long-term care. And I think the first step is let's address some of these basic needs issues, some of the proposals that were presented here first and foremost. And we can't. It's a ball of yarn. You know, you can grab any string. It's all interconnected. And so we just have to be really mindful of that. So thank you.
Thank you so much for coming today.
May I make one more
Yes.
comment? As Rochelle was talking about, you know, where we live, I live at Senior Manor in Fairfield, and the management is just, well, it's awful. I am the head of the tenant association there. We have comprised a whole list of grievances with the management company and with the owners. We have sent out certified letters to them asking for meetings, but we also have hooked up with Fair Housing, who has been out 3 different times now to our complex and has a list a mile long of things that need to be done there. And also we are working with the state legislature, legal services, and we have a lawyer. So I feel like we're going to make some headway in order for senior rights, for people that have been tyrannized there, for people who have been told they're going to lose their Section 8 housing, for people that are constantly being threatened with eviction notices. Even I got one of those. It just goes on and on. But, you know, unfortunately, this situation repeats itself in all of these senior communities simply because so many of the seniors who are older than me even don't know how to fight for themselves. They are afraid to speak up. They're afraid to say what has been happening to them because they are scared, you know what, that they are going to lose their home.
Well, I really appreciate you bringing that to our attention, and I'm not sure of how we can address that here, but you're being heard,
Right.
and know that
That's
you're
all I
being
want is
heard.
to be heard.
And this was a good day for you.
Thank you.
That's all I can say is it's a good day for you. But thank you so much for coming.
Thank you.
Okay, thank you.
Our next panel are three experts who will describe the incidence of food insecurity, health insecurity, and housing insecurity among senior Californians. We have Ms. Keisha Nzawi with Alameda County Community Food Bank, Dr. Ann Chodos from UC San Francisco, and Ms. Rachel Caviallo from Affordable Living for Aging in Los Angeles. Please have a seat. I want to thank you, Mr. Calderon, for coming today, and I know you have something else that you have to do. We will have a follow-up report on this meeting. Thank you.
Sure. All right, thank you. Okay. Yeah, you would do it there. It was working before. Yeah. But okay. I can sit here. Can I sit here and do it?
Oh, yeah.
Okay.
We're our panel's getting settled. Sometimes technology creates short pathways, and sometimes it just takes a little time.
It does. Madam Chair and members, my name is Keisha Nzui. I'm from Alameda County Community Food Bank, and I'm our advocacy manager. And I'm really honored to have the opportunity to speak to you today about what we consider the human cost of the $1 billion in cuts to SSI and SSP over the last few years. So the Alameda County Community Food Bank conducted our 2014 hunger study, and through that study we discovered that the number of people relying on us went up. So we now serve 1 in 5 Alameda County residents, or 20% of our county, and that means 20% were just left behind, as although everywhere you hear the economy is recovered and things are bright and happy, but for 20% that's not the case. So I like to imagine that the Raiders are really good and the Coliseum is sold out. But unfortunately, if we fill it up again, that's how many people our food bank are serving every month. And for many of those folks, and many that I met, especially when we conducted the study, we're their regular source of groceries. They have to depend on us quite often, not just as food banks were established, not just in the case of emergency, but we're a regular source of food. And to no surprise to anyone, our clients are making the most difficult decisions that no one should have to make and that have been illustrated in the panels before. So our characteristics, about 15% of our clients are 65 years of age or older. About 25% of our clients live in temporary housing, so that includes not just shelters, that includes living with someone else or recovery homes or anywhere where they're not necessarily paying rent or mortgage of their own. Among our households where no one was working, 60% were disabled or in poor health or act as a caregiver for someone else. 23% of our households are grandparents who are taking care of their grandchildren or even great-grandchildren. 40% of our households have a member who have high blood pressure, and 20% have a member that have diabetes. And we've talked a lot about poverty, but 65% of our households are below the federal poverty level. Almost half of our households earn less than $10,000 a month. And if you take what the maximum SSI grant is in California, that adds up to only $9,000 and some odd dollars. So it's no surprise that so many of our households have less than $10,000 a month. And 65% of our households are food insecure in any given month. And what that means is that at some point in the month, they have no idea where they're going to get their next meal. So it's a myth, we think, that people think that we can survive on $889, and with all of the elder index talk of the previous panel, we know that's so not true. At the food bank over the past month or so, we've done a survey with people who've called for food who also receive SSI. We know that in California, a studio average is $1,000 a month. And among the clients who we surveyed over the past month, they spend on average $65 on transportation. And more, and half of the clients utilize public transportation, not their own car. $230 is spent a month on food on average, which isn't enough. That's why they're calling us. And $46 is the average amount spent on medicine or medical care. And as a previous slide or an upcoming slide, I think I've got multiple slides that mention those impossible costs, especially among seniors. We hear it a lot that they have to make choices between food and rent, food and light, but really food and medicine is a true reality. So 1,341 doesn't equal 889. So as I just mentioned, from the study, we found people are making heartbreaking choices and heartbreaking coping strategies, from watering down food, which includes soups and milk, like things like that, and juices to make it last much longer. Given the poor health of many of our client households, the fact that they have to purchase foods if they have that opportunity to purchase food, regardless of its nutritional content, despite the chronic illnesses that they're trying to manage that are sensitive to the nutrition that they receive, that 74% have to buy just the cheapest food. And then again, we're in a prosperous state, as you opened up with, and that's happening right here. And I would argue that our county is far from unique. In fact, our county, as I've laid it out here, is probably doing better than many counties through Central California and parts of Southern California. So it was mentioned earlier, we've plunged 1 million people into poverty. 1.3 million people have suffered from these cuts, and as I mentioned, over the past month we've conducted this survey. So we also went to St. Mary's Senior Center in Oakland, and I wanted you to hear their voices.
One of the things about SSI that's really been horrible for me is that my inability to build equity and my inability to move out of a place of poverty.
I could never get anything decent that I wanted to eat. Even to put gas in my truck, to launder my clothes, to do anything. It's just like there are no services that really work. So now I'm homeless. Now I'm homeless and I'm living in my pickup truck with 2 dogs because it's getting near the end of the month and I can't even afford to eat. I can't even go to McDonald's or something. I ate a can of cold chili con carne last night for dinner. It cost $2.29, and that was a lot. And I don't feel like the world or society has been fair to me at all. I worked hard for many years. I raised my family. I did what I was supposed to do, and this is the way I wound up.
California says we're in trouble, we don't have the money, but yet they consistently cut the people that have no voice.
And I got my master's degree in 2011. This is 2015, and I've been pushed out of my home with my Section 8 voucher. Everything is going downhill.
I can say I'm literally starving to death because, my rent is $800 a month. Okay? And if I got $20 bus pass and pay my phone bill, I don't even have enough money. I have to borrow some money to do that.
We need a increase that's compatible to the cost of living. The cost of living for food costs me $300 a month. Everybody who's below federal poverty level needs to apply for food stamps.
That, I'm mentally ill and disabled, and there's stigma. Landlords don't want me, and other people ostracize me. And even though I have a mental illness and I am disabled, I went to school and I did things to make myself employable. And I can't get out. I'm slipping further back because of the cuts. It's making it worse as I get older. I have not been able to save money. And And I think that's what is ridiculous about the amount that they give you, because if they gave you enough that you could save and you could develop yourself and develop your life, then they would have less people on SSI. They would have less people on SSDI. People would be able to move forward. But what they do is they give you enough so that they keep you alive to struggle and be in pain and suffer. They don't give you enough to have any quality of life.
An extra loaf of bread or some milk, food, eggs. Oh my God, $5 a dozen.
Yes.
You just can't afford it. Yeah. You know, so I just wanted to say, when you working on these jobs, you get hurt. Honey, that threw me in absolute poverty. I lost my house. I couldn't afford house notes anymore. I couldn't afford PG&E, water, gas, and all that, stuff. So I lost everything. See, nobody's saying, how do we help you to regain what you had, your status that you had in life?